Can I ask, first of all, what the percentage increase in the number of patients at A&E has been in your group of hospitals compared to the previous year, please? Sorry.
So I'd have to go back and check the actual percentages for you, Una.
More or less.
In the slide that we tabled today, we have got the actual numbers in there.
Is it 5%, 15%, less than 10%?
So if I could just draw the committee to the slide on page 18. It just does take you through the numbers, and it's hard to give you an absolute number because it does vary from site to site, but in generalities what I could say to you is that at the St Mary's site we've had somewhere between about 30 and 60 additional attendances a day, and at the St Mary's site we've had up to about 15 additional admissions per day. And that was in line with the planning assumptions foreshadowing on the future. And so if you look at that as a percentage, it will give you a percentage. So 30 on a base of 138, sorry, got the wrong number there. I'd have to add a couple of numbers together, which I can't quite do off the top of my head. We'd have about 21,000 there in a week, and I'd have to divide by 7, but if you'd like to see,
3,000.
thank you.
So 3,000 plus the number you gave.
So it's looking at something like 15 to 20%.
No, 15 to 20 patients.
No, we're talking, I'd like this as a percentage because in the national press they are quite widely quoting something like 15 or 17% this year compared with previous years. Now, the more substantial thing that I wanted to talk about is that in The Guardian, for the first time, I read an interview with Professor Sir Bruce Keogh about new developments in what they call telemedicine, which is apparently going to be the saviour of the National Health Service. And this is the first time that I have read anything in the British press about this, although it's widely known in the USA, but has been the subject of a certain controversy because of the huge amounts of money involved in the equipment, the monitoring, the whole infrastructure. And it would appear that this is a whole area of discussion that simply hasn't occurred. If it is proposed to have, and I'd be interested to know why you're laughing, Dr. McGedrew. If it is proposed that the elderly population will become the guardians of their own health through the widespread adoption and monitoring with software by, for instance, a company called Deboco, this is something we should be told about in the first place. And secondly, I have seen no demographic studies that show that London, which of course is mainly a working population under 65, what assumptions have been made about the changes in the demography that are going to substantiate the case for this type of technology and the concomitant reduction in the number of Tier 1 A&E departments, which I believe, although I've never seen it stated as such, is the underlying assumption for reducing in half the number of A&Es and the capacity for A&Es in the whole of London. Thank you.
Sorry, I just wanted to say something briefly about the telemedicine thing, because it's not something that we've been ignoring locally or NHS England. About 3 years ago, I think, the CCG had some funding trying to identify some areas where telemedicine might be useful in the locality. So we did some joint work actually with Imperial College, who have a department who've done some quite extensive research in telemedicine, and we're at that point in time trying to develop some applications themselves that might be used in patients with diabetes. So I think there's been a number of pilot sites nationally which have rolled out various aspects. Yeah, and in Cornwall. There's several of them across the nation, but the evidence that's been brought out from those, from the interpretations that I have seen and from the assessment of the Imperial College team, suggests that telemedicine can be very effective and very helpful in terms of monitoring patients who live in a more rural environment, but that when you're living so close actually to assessment by a district nurse or assessment by your GP, that there's not a huge amount to be added in a very densely packed inner city environment. That was the assessment from the academic department in Imperial College up the evidence at that point in time. So we did some initial investigations looking to see what area we might be thinking about implementing. It was a one-year scheme funded by NHS England to examine options with no consequent funding following on from that. But actually having invested some of that money for Imperial College to do a review of the current research for us, we came to the conclusion that we couldn't see a role for it at that point in time in the locality.